Hi, I'm Dr. Marcia Sirota, and today I want to talk about how you can be helpful and supportive to people in your life without crossing their boundaries and behaving like you were their therapist. Now, over the years, a number of my patients have asked me this question because they have learned a lot of tools and a lot of skills in their therapy. They've gained a lot of insight. And sometimes they see a friend, a family member, or a partner engaging in some kinds of behavior which they see as problematic, but they don't want to start being their therapist and they don't want to violate their boundaries. So they've come to me and they said, how do I help this person? How do I support this person without, doing the wrong thing, without going too far? So I have a group that I led for a number of years, up until COVID, of course. And this group therapy was wonderful because it gave people tools for how to communicate with one another without violating their boundaries. So with my patients, I always remind them of the principles of group, which is that you can express your feelings, your needs, your observations, and you can also talk about your own experiences. So as long as you don't go beyond that and start saying, analytical things about the person, trying to psychoanalyze them, identify their motivations, their underlying conflicts, things that a therapist would do, then you're going to steer clear of violating their boundaries and you're going to be able to be of support. So I'll give you some examples because that's going to be helpful. So I had a patient whose friend was drinking alcohol to excess and she wanted to be of support. So she went and she used these simple steps that I told her about sharing your feelings, your needs, your experiences, and your observations. So she went to her friend and she said, I've observed that you have been drinking to excess and it's really bothering me and I feel concerned for you. And then she shared her experiences with her own issues with addiction, and she talked about how she had overcome addiction through the tools that I had recommended in therapy. And through that, her friend was not offended, her friend was not angry or upset because my patient did not violate her friend's boundaries. She did not say, I think your childhood trauma has led you to this dysfunctional coping strategy. Now, that would not be an appropriate thing for a friend or loved one to say. That's something that you've hired your therapist to say. And unless you have hired a professional and you have engaged in an ongoing therapeutic relationship with someone, it's not appropriate to talk about their childhood trauma in the context of their addiction. Okay, just make that clear. So what happened though was that the friend really was able to hear my patient and hear what they had to say, how they felt, what they had observed, and they went for help. So that was a good outcome. Another kind of situation that I remember a while back was that one of my patients had a friend who was a people pleaser, and she was saying, how do I help? And I said, remember how you talk to people in group, you share your feelings, your needs, your experiences, and your observations. So again, she went and she spoke to her friend and she talked about her own experiences as a people pleaser. She talked about how she had also tried too hard to be nice in the past and how it had always backfired on her. And now here she was observing it in her friend. She even said, it's not surprising we're friends because, people find other people who are similar. And she said, I've observed that when you do this people pleasing, you get a lot of negative outcomes. And I really hope that you can see what you're doing so that you can have better outcomes with your relationships, because it makes me sad when, you get mistreated and taken advantage of. So that was another example of somebody using those simple tools, those simple 4 things, sharing your needs, feelings, observations, and experiences with the other person to help them change their behavior if they choose to. So when you want to help somebody, you need to tune into how it's making you feel, to how their behavior or how their choices are making you feel. If they're making you sad, angry, upset, hurt, frightened for them, frightened for yourself. And again, those are the kinds of things that you can share. So starting with tuning in to your own experiences and your own feelings, that's really helpful. Then again, remembering your own past history. Do you have anything in common with this friend? Have you had similar kinds of experiences in your own life that you have overcome or that you have struggled with that you could share with this person? And then again, talk about your needs. I would really like it if you could change because when you're like this, it makes me feel bad, it makes me upset, I don't feel connected to you. So you share your feelings, how it feels to observe their behavior, your observations of the behavior or the choices, your needs. I would really like this. It would really make me happy if you could do this. and then you share, if any, experiences that you have that are similar. That outcome, again, was really good with the ex-people pleaser and the current people pleaser, because it came from a place of empathy and compassion, and the friend was able to see, yeah, you know, I get it, it's not working, didn't work for you, and you were able to overcome it, maybe I can do that too. So when you have people in your life, a partner, a friend, a family member, who is struggling, who's going through addiction, or who has depression or anxiety, or who's engaging in some kinds of dysfunctional relationships, or any kind of thing that's making you upset or concerned, if you feel comfortable, certainly you don't have to do it, but if you feel comfortable and you want to help them, then it's very simple. Just do those 4 things. Share your feelings, your needs, your observations, and if any, your experiences. And then you can be a really great support to somebody in your life without it having to be a violation of their boundaries. You're not psychoanalyzing them. You're not crossing any boundaries that are inappropriate, because you're talking about how you feel, what you need, what you've observed, and again, you know, what your own experiences are. Also, you're not telling them what to do. You're not telling them who they should be or how they should be. And you're certainly not, you know, going into that psychoanalytic place where you're explaining them to themselves, which people will probably feel quite offended by and quite, you know, violated and upset by, which could definitely hamper your relationship and certainly won't help this person with their issue. So trying these things can be, you know, a little bit scary because you don't know how the other person will react. And of course, if the person reacts badly, it's probably because they are defensive and they don't want to see themselves or change. So don't take it personally, and you can just back off, and hopefully you can salvage the friendship. And then you have to decide whether you still want to be friends with somebody who is not really willing to change some problematic behaviors. But that's for another conversation. So that's just a simple way to remember how to help people without getting into the therapist role, because you don't want to do that. Remember, the only people who should be therapists are people who have been hired to be therapists, and they have engaged in a deliberate relationship in which one person is the client and one person is the therapist. Otherwise, there's no place for being a therapist in any relationship. So you can definitely be of help and support without being somebody's pseudo-therapist. And that can be much, much better, and definitely can lead to a good outcome with the person having some insight and possibly changing, and you feeling better because this person's behavior is improving. I'm Dr. Marcia Sirota, talking about how to be a supportive person in someone's life without crossing their boundaries and acting like their therapist. Stay tuned for more content. I'll speak to you soon.